everyone. I'm Shanda Gallego in for Donna Bush with your news brief and weather forecast on this Friday. Thank you for joining us. Premier Honourable Wayne Panton announced some upcoming changes to current COVID-19 regulations at a press briefing yesterday.
I will offer some brief highlights of what we seek to achieve in the control and management of COVID-19 number 2 regulations. These regulations consolidate the prevention, control, and suppression of COVID-19 travel and boating regulations and the control and management of COVID-19 amendment regulations that previously existed. In respect of the changes, public gatherings for now remain at 100 persons for indoors areas and 250 persons for outdoors. However, we have made some allowances. If the venue can host an event splitting the numbers of persons indoors and outdoors, then the event is allowed 100 persons indoors and 250 persons outdoors with the same venue. If it is an event at an outdoor venue that can be divided into 2 or more partitioned areas, activities can simultaneously be held in each of those partitioned areas, not exceeding 250 persons in each area. These provisions do not include the staff of the venue in the number of persons allowed. We understand that we are moving towards the festive season, and there is a need to support businesses as they welcome larger gatherings. With that balance in mind, one exemption which we will allow is in respect of premises which can exceed the gathering limits by the owner or operator arranging for approved testing of patrons with lateral flow tests. These would need to be completed by a registered practitioner that verifies a negative result for all patrons and employees no more than 24 hours before the gathering. The updates to public gatherings do not apply to the following: businesses or office premises, educational institutions, emergency shelters, and churches.
The Premier also announced that the legislation, which is expected to be published on the Cayman Islands Gazette website, will also reintroduce ticketing offences for breaches of COVID regulations, with fines ranging from $250 to $1,000. Tourism and Transport Minister, the Honourable Kenneth Bryan, offered an update on government's work with tourism sector partners to prepare the industry for the official reopening of tourism on Saturday, November 20th. In addition to updated sanitation guidelines, Mr. Bryan said his ministry was set to shortly publish a policy on rapid testing for the industry.
Strongly recommending that all tourism-related businesses implement twice-weekly testing programs for their employees and stakeholders. The policy stipulates that travelers, which includes tourists, returning residents, and Caymanians, are required to take a lateral flow test on day 2, 5, and 10, where arrival day is day 0. So when you arrive in the Cayman Islands, your first day doesn't start till the next day. All travelers must be tested and results certified by a testing provider. I'm very happy to share that we are working to expand the testing capacity to doctors' offices, including locations such as Health City Cayman, Doctors Hospital, 7 Mile Beach Medical Clinic, and over 25 other healthcare providers. The full list will be publicized on the Department of Tourism and the government's explore.ky website to ensure certified LFT testing services are readily available to all travelers across the 3 islands.
All information on COVID-19 prevention measures in the tourism sector that is currently publicly available can be viewed on the Department of Tourism website, that is ourcayman.ky. Meanwhile, the Minister for Health and Wellness, Honourable Sabrina Turner, shared a number of upcoming and already completed upgrades to public health and Health Services Authority resources in the fight against COVID-19 at the press briefing on Thursday. Speaking at Thursday's government press briefing ahead of the COVID-19 reopening, the minister detailed changes to physical and human resources, including standing up a field hospital at Family Life Center.
I am also pleased to advise you that arrangements to set up this field hospital at the Family Life Center has now been initiated and will be operational in the next few weeks. Now, this facility will hold a capacity of 80 beds. However, it will be set up in phases so that initial beds will aim to be ready for mid-December. Many of you may saying, oh, well, I'm hearing that the hospital is overwhelmed. What's the sense of having beds when you do not have staff? I will cover that as well during this presentation to reassure and dispel of all of those fears and give a true better understanding of what overwhelmed means as it pertains to clinical care and overwhelm in not being able to handle capacity. Now, with this facility, the care of less severe COVID patients will free up the HSA so that it will allow them to continue to its elective work without interruptions. And more COVID patients will continue to be cared for, of course, at the hospital. HSA is also working to recruit individuals. This is to be able to staff the field hospital. And these individuals are being sourced both locally and overseas because we do admit that we do have some persons from the legal field that are retired, that are here, that are willing and capable of lending their talents and help us during this crisis. So HSA has already recruited over 30 nurses who will be starting within the next 2 months, and with more job offers and interviews that are still ongoing.
The minister also noted that one area already benefiting from increased staffing was the flu hotline.
The flu hotline has been expanded with additional staff operating from a new location, and this is due to the increasing of our capacities to respond more efficiently to the growing volumes of calls to reduce hold times for those who are calling, as well as improving the work environment for staff overall. With this designation, we will have all persons operating safely from one location so that we can gauge and manage even the response. With the additional demand in waiting times, some can be as long as 5 minutes, and we understand with the frustration, a minute can seem like an hour. I'm asking each of you to please bear with us as we strive to deal with each person and give everyone that individual personal care that we all deserve.
For more details of the drive to improve service in the healthcare sector as the global COVID-19 pandemic continues, visit the government website. Turning now to today's forecast. Tonight, there will be partly cloudy skies with a 20% chance of showers. Our temperatures will fall to the mid-70s. Winds will be east to northeast, 5 to 10 knots. Seas will be slight with wave heights of 1 to 3 feet. We've got light northeasterly winds and seas over the Cayman Islands for the next 24 hours, as a cold front currently along the southern United States is expected to drift south towards the northwest Caribbean. Satellite images show scattered showers, clouds northwest of the Cayman area. A reminder that you can find the latest on local weather conditions online at weather.gov.ky or simply download their app on your mobile device, CINWS. And that is it for today's news brief here on CIG Television. I'm Shanda Gallego, inviting you to join us here again on Monday. Until then, have a great weekend.
Join Donna Bush weekdays at 6 p.m. for the CIG TV News Update. Get the latest on what's happening in government on a daily basis. News Update first at 6 p.m.